Okay, in this video, we're going to quickly look at human papillomavirus, and I'm going to give you some insightful information or some quick pointers, about HPV transmission, its acquisition risk with respect to a relationship, how to prevent HPV, and a few pointers, a few really quick pointers. Now, remember, HPV is a viral infection. It's a sexually transmitted infection. The commonest mode of spread is through orogenital as well as penovaginal and penoanal sexual intercourse. It spreads more among women who have had multiple partners. Like, say, if a single woman has had 2 or 3 partners, sexual partners, they have been more of a casual relationship and short-term sexual partners. And if she frequently cycles men and then she comes to you and you enter into a relationship with her, there's a high risk of you getting HPV and also other STDs, mind you, from that particular woman. And also, it is more common in women who have become sexually active at a very early age. So, women who become very sexually active at, say, 16, 17, 18, by the time when they come for long-term relationship, at the time of 25, 26, 27, they've already cycled through 4, 5 men. And then when they come to you, you are again at a high risk of contracting HPV from them. Bear that in mind. Also, if you meet a woman, you've met her, say, in a party place or in a club or, in a really nice event, and, she smokes a lot and she drinks, and she's had a casual, and she's had a couple of dating sprees, mating sprees, and then over there again, you are at a high risk of contracting HPV from her. So remember, this is all studies, it's all put in the WHO website. It's there in the Center for Disease Control, CDC website. You can look it up. Now, the problem with HPV is, women, HPV causes cervical cancer. With respect to men, there's a high risk of nasopharyngeal cancer, right? It's cancer of the throat. So once you get that, pretty much screwed. You don't want that, right? So always use a condom, or you preferably use a double condom, especially if you're contacting someone in a party place or in an event, right? Because there's no way to predict someone's sexual history by spending 20 to 30 minutes. No one's going to open up on their past with you at the first outset. And sometimes these things happen, right? Over alcohol. And also avoid drinking alcohol with someone you don't know very well. Don't share a drink immediately with people. Don't even drink in the first place. So why will you share a drink? So these are all high risk behaviors which will, trigger you, and eventually you end up with this sexually transmitted infection. HPV is notorious, mind you. And also, it's important never to give orovaginal intercourse. Like, you don't put your mouth to the vagina and end up ingesting the HPV infection, right? It's worse enough that you're doing vaginal intercourse without a condom. Now, don't want to amplify the risk of contracting HPV by putting your mouth to someone's vagina, someone you don't even know well enough. So these are the key points to bear in mind, right? And you can prevent HPV by vaccination. Take Gardasil 9. It's a US FDA approved vaccine for HPV. I strongly recommend it. And up to I guess 35 to 40 years of age is the upper limit of the vaccination. If you have had no prior exposure, take the vaccination and get tested frequently, once in 6 months, once in a year, for HPV, HSV, HIV, chlamydia, gonorrhea, all STDs. If you are someone who casually meets people, who has casual relationships and encounters. Hope you like the video. Please like, comment, and subscribe channel. I'll see you soon with other videos. This is Dr. Shah signing off for now.